Betel, commonly consumed as betel quid, a combination of betel leaf, areca nut, slaked lime, and often tobacco or spices, has complex effects on the human body due to its bioactive compounds, primarily from the areca nut, Areca catechu, and betel leaf, Piper betel. Below is an overview of how betel works in the body, covering its physiological, neurological, and systemic impacts, along with potential benefits and risks, based on available scientific insights, key components, and their roles. Areca nut, betel nut. Active compound. The primary psychoactive compound is arecoline, an alkaloid that acts as a parasympathomimetic, mimicking acetylcholine and stimulating the central and autonomic nervous systems. Other compounds contains alkaloids like guvacholine, aracadine, and guvacine, as well as tannins, polyphenols, and safrole, which contribute to its effects. Betel leaf contains phenolic compounds, for example, hydroxychavicol, eugenol with antioxidant, anti-inflammatory, and antimicrobial properties, often used as a wrapper for the quid. It enhances the absorption of arecoline when combined with slaked lime. Slaked lime, calcium hydroxide, increases the pH in the mouth, facilitating the release and absorption of arecoline through the oral mucosa, allowing it to reach the brain and other organs quickly. Additives, tobacco, spices. Tobacco increases the carcinogenic and addictive potential. Spices like cloves or cardamom enhance flavor, but have minimal physiological impact. How betel works in the body. Neurological and psychoactive effects. Stimulant effects. Arecoline stimulates the central nervous system, acting similarly to nicotine or caffeine. It activates nicotinic and muscarinic acetylcholine receptors, leading to increased alertness, euphoria, and a sense of well-being, enhanced stamina and work capacity, increased salivation and sweating. Mechanism. Arecoline is rapidly absorbed through the oral mucosa, especially with lime, and crosses the blood-brain barrier. It increases levels of neurotransmitters like dopamine, norepinephrine, and epinephrine, activating the brain's reward system, which contributes to its addictive potential. GABA inhibition. Aracadine and guvacine, formed in the presence of lime, inhibit GABA uptake, enhancing arousal and contributing to psychoactive effects. Potential antidepressant effects. Some studies suggest betel quid may reduce symptoms of depression or schizophrenia due to its catecholamine-releasing properties, though evidence is limited and long-term use is unsafe. Cardiovascular effects. Betel chewing increases heart rate, blood pressure, and body temperature due to sympathetic nervous system activation via norepinephrine and epinephrine release. Chronic use is linked to cardiovascular risks, including myocardial infarction, cardiac arrhythmias, and increased risk of fatal coronary artery disease, especially when combined with tobacco. Some studies suggest betel nuts may improve blood circulation and reduce high blood pressure in specific contexts, but these findings are preliminary and require further research. Digestive system. Positive effects. Arecoline stimulates salivary glands and gastrointestinal contractions, potentially aiding digestion and relieving constipation. Betel leaf's carminative and anti-flatulent properties may soothe the digestive tract and reduce stomach discomfort. Negative effects. Long-term use can cause nausea, vomiting, abdominal pain, and increased risk of gastrointestinal disorders. Betel leaf's anti-ulcer properties, due to antioxidants and phytochemicals, may protect the stomach lining and reduce oxidative stress, potentially aiding ulcer healing. Metabolic and endocrine effects. Blood sugar regulation. Animal studies suggest betel leaf and nut extracts may lower blood glucose levels in diabetic rats, possibly due to alkaloids like arecoline or antioxidants like eugenol. However, human studies are lacking, and self-medication is not advised. Cholesterol management. Betel leaf's eugenol may reduce cholesterol production in the liver and lipid absorption in the intestines, potentially lowering the risk of stroke. Other effects. Chronic use is associated with metabolic syndrome, hyperlipidemia, hypothyroidism, and prostate hyperplasia. Oral and dental effects. Short-term, betel quid produces copious red saliva due to tannins and other compounds, staining teeth, lips, and gums red-brown to black over time. Antimicrobial properties. Betel leaf's phenolic compounds, for example, chavicol, eugenol, have antibacterial and antifungal properties, potentially reducing oral bacteria and treating fungal infections. Negative effects. Chronic chewing, especially with tobacco, causes gum irritation, tooth decay, oral submucous fibrosis, an incurable condition causing jaw stiffness, and precancerous lesions like leukoplakia. Immune and anti-inflammatory effects. Betel leaf's antioxidants, for example, polyphenols, flavonoids, neutralize free radicals, reducing oxidative stress and inflammation. This may help manage conditions like arthritis, asthma via antihistamine properties, and allergies. Animal studies suggest betel leaf extracts may have anti-cancer properties by slowing cancerous cell growth, but human evidence is insufficient. Reproductive and pregnancy effects. Betel quid chewing during pregnancy is linked to adverse outcomes, including stillbirth, premature birth, and low birth weight due to aracoline's toxicity and systemic effects. Traditional claims suggest betel leaf may improve female reproductive health or act as an aphrodisiac in males, but these lack robust scientific backing. Wound healing. Betel leaf extracts, rich in antioxidants like hydroxyproline, may accelerate wound healing, particularly for burns, by reducing oxidative stress and promoting collagen synthesis. Animal studies support this, but human trials are needed. Potential benefits. Traditional uses. Betel leaf is valued in Ayurveda and Chinese medicine for its antioxidant, antimicrobial, anti-inflammatory, and digestive properties. It's used to treat constipation, ulcers, arthritis, infections, and depression. Mild stimulation provides an energy boost, alertness, and mood enhancement, making it popular in labor-intensive industries. Antioxidant and anti-cancer potential. Betel leaf's phenolic compounds may protect against oxidative stress and certain cancers, for example, oral colon, though evidence is preliminary and limited to animal studies. Risks and side effects. Carcinogenic risk. The World Health Organization classifies areca nut as a Group 1 carcinogen, strongly linked to oral, esophageal, and throat cancers, especially when combined with tobacco, for example in gutka. Betel leaf alone is not carcinogenic, but its use in quids with areca nut and tobacco increases cancer risk. Chronic use causes oral submucous fibrosis, a precancerous condition that can lead to mouth cancer. Addiction and dependency. Aracoline's effects on the brain's reward system lead to tolerance, craving, and withdrawal symptoms, for example, irritability, headaches, similar to nicotine addiction. Systemic toxicity. High doses, 830 grams of areca nut, can cause severe effects like vomiting, diarrhea, kidney disease, liver damage, heart disease, asthma exacerbation, and even death. Chronic use is linked to liver toxicity, cirrhosis, and hepatocellular carcinoma. Other side effects. Short-term dizziness, nausea, vertigo, and diaphoresis, especially in new users or with high doses. Long-term gum problems, tooth decay, and staining of oral structures. Drug interactions. Aracoline may interact with medications for glaucoma, Alzheimer's, or depression, increasing side effects. It may reduce the efficacy of antihistamines or antidepressants. Cultural and practical context. Betel quid chewing is a cultural practice in South and Southeast Asia, the Pacific Islands, and parts of East Africa, used by 1,200 million people globally. It's often consumed for social, religious, or work-related purposes. The practice is deeply ingrained, but considered a public health emergency due to its association with oral cancer and systemic diseases. Precautions. Moderation. Consuming 1-2 betel leaves daily is generally considered safe, but avoid excessive use or combinations with areca nut and tobacco. Avoid during pregnancy due to risks of adverse fetal outcomes. Consult healthcare providers, especially for individuals with asthma, heart conditions, or those on medications, as betel can exacerbate conditions or cause interactions. Source quality. Use fresh, clean betel leaves from reputable sources to avoid contamination. Conclusion. Betel quid, particularly due to areca nuts arecoline, acts as a stimulant affecting the nervous, cardiovascular, and digestive systems, with short-term benefits like increased alertness and digestion. Betel leaf alone offers potential antioxidant, anti-inflammatory, and antimicrobial benefits, but these are overshadowed by significant risks when combined with areca nut and tobacco. Chronic use is linked to serious health issues, including oral cancer, cardiovascular disease, and addiction. Limited human studies mean many benefits, for example, anti-diabetic, anti-cancer, remain unproven, and the World Health Organization warns against its long-term use. Always consult a healthcare professional before using betel, especially for medicinal purposes, and avoid self-medication.